What's up, Mom or Dad? Dr. Peter Martinez here, and today I want to talk to you about one thing that could change the trajectory of your family's health forever, and that is unraveling that perfect storm. Have you been to a provider? Have you been to a doctor and just said, I don't know how your kid ended up like this. I don't know how this happened. It's just a perfect storm of variables, of genetics, of toxins, of mishaps. And they're just going to be stuck. They're going to be stuck with this diagnosis or labeled with this diagnosis forever. And that doesn't have to be the case. So today we're going to unwind that perfect storm. And I'm coming to you first and foremost as a father. I'm a father of a 4-year-old, a 2-year-old, an 11-month-old. We call it the family circus because it's not as easy as it may seem from the outside, and it definitely gets harder and harder with each child. But the next level of challenge really hits home when your kid is struggling, when they're struggling with their health, when you're just trying to go to a restaurant, you're trying to get ready for school. The very simple things are not as easy as they seem because your kiddo is struggling to thrive and struggling to have the health that you'd always dreamed or imagined for them. The reality is there is a sequence to sickness. There's a sequence to stressors. There's an order to traumas and challenges that basically were put into your child's health that led to where you are today. And it started in reality in utero. What we found is over 50% of the clinically documented cases where kids were struggling with things like ADHD, neurodevelopmental disorders, emotional behavioral disorders, SPD, autism, over 50% of those cases, the mother had significant mental and emotional stress during the prenatal period. When you add also things like chemical stress, we know that it affects the baby. That's why moms, if they're smokers, the moment they find out they're pregnant, they will stop smoking. They will stop drinking. They will stop ingesting toxins that they can control. We know that toxic stress, chemical stress, physical and emotional stress does affect your child's brain and health, even in utero. So when you have a challenging, stressful pregnancy, that sets up a challenging, stressful birth. So check this out. We saw in over 80% of these cases, 80% of the cases of moms and dads who have come in saying, I need help with my kiddo, there was some sort of intervention in the labor and delivery process. So this could include epidurals, could include C-sections, forceps, or vacuum extraction. There was trauma that was applied to your child's nervous system, to their brain, to their neck in that birth process. It didn't go maybe as you wanted it to go, and it was stressful. Thank God we have a lot of these interventions because the reality is it saves many of these kiddos' lives. But for example, just applying vacuum or suction distraction to bring that child into this world puts 55 pounds of pressure on your child's neck and brainstem. That's 55 pounds of pressure on this little tiny infant baby. The first thing that happens when a child is given to me or given to you, when you get to hold that newborn baby, what's the thing that you protect the most? It's the neck, it's the head, right? We would never, ever wiggle a child around, let alone take a child upside down and hang a 55-pound weight by their neck, but that's how much pressure and tension and trauma is applied to this little kiddo's nervous system when there are interventions like forceps or suction in birth. So there's a lot of trauma in the birthing process, and we're going to dive more into that later. So we saw 50% of stresses in utero, 80% of the cases of kids that are struggling with neurodevelopmental disorders had some sort of intervention in birth. And then you have a kiddo that is becoming colicky, that's becoming their nervous system is stressed out and they are starting to be constipated or gassy. And you go to the doctor, you go to the pediatrician, they say they'll grow out of it, right? And the reality is they don't grow out of it. Or you hear things like, you're just a first-time mom, you just need to learn to sleep train, right? But you know in your mom gut and your dad gut that something's wrong with your kiddo because the diaper is clean, they are fully fed and happy. You try to lay them down, they will not sleep. They are chronically crying and they are arching in pain. You know that something is off. So what we know is that in autism, and neurodevelopmental disorders on the severe end of the spectrum, that it is 4 times more common to have constipation in those in kids with autism. So basically, those kids that are struggling with their brain health often have bloating, distress, and neurological stress in their gut, right? So you have a stressed out, colicky, constipated baby, and that turns then into a sensory, constantly sick or challenged toddler, right? And so that toddler is struggling emotionally. You cannot go from the house to the doctor's office, to the house, to a friend's house, to the house, to a restaurant without just emotional breakdowns. They are screaming the entire time in their car. And these are kids under 3 that are struggling and they're chronically sick. They're starting to get ear infection after ear infection, and you're having conversations like, we're gonna have to put tubes in their ears. You're always at the pediatrician, antibiotic after antibiotic. What we see is that kids using antibiotics and children under the age of 3 that have had antibiotics, we see a 3-fold increase in allergies. We see sometimes up to 2 to 4-fold increase in neurodevelopmental disorders in kids that have had an antibiotic under the age of 3. And why do they need this antibiotic is when you think about this colicky baby, that is trauma, that is inflammation, and that is keeping your kiddo from draining. So the immune system is actually very simple. The immune system is really all about plumbing. Your kiddo gets sick, they need to mount a healthy inflammatory response, and guess what happens? They get very mucousy, right? And all that mucus is designed to encapsulate the bug for your immune system to do its job. But if that body is producing more mucus to fight the infection in your kiddo, it needs to be able to drain somewhere, right? And so the inability of that fluid to drain often is what leads to those ear infections. The inability of that fluid to drain leads to chronic coughs. But then when that fluid drains, it goes into the gut, and your body is designed to get rid of it, right? Through the GI system. And the reason the body brings it through the GI system is 70 to 90% of our kiddo's immune system takes place there. So if they can't drain through that system, they're going to get more of a buildup. And if they have had antibiotics under the age of 3, you've literally wiped out every healthy attacker, every healthy offense that they have in their gut to fight the infection. 70 to 90% of our immune system is in our gut. And if we've had an antibiotic under the age of 3, what we find is that child is sick and sick and sick, week after week, 4 weeks at a time. You feel like you're always going to the pediatrician. And so these kids are struggling. And so you had a stressful pregnancy, you had medical intervention and a stressful birth, then you have a constipated, colicky, stressed out infant who, you're just told, hey, they're gonna grow out of this, but really they grow into being a sensory kiddo, a sensory toddler, a chronically sick toddler in and out of the pediatrician's office. And when you have that chronically sick toddler, instead of them growing out of those challenges and that stress, what you start to see is the sensory spectrum, hyperactive, emotionally stuck child, right? And this is where the red flags start coming up. What we have seen is rates of autism are now 1 in 44 in children, and it's 4 times more likely than that in boys. ADHD is now up 67% in the last 20 years with 3.5 million kiddos on ADHD medication, right? And there is a time and a place, and I'm not bashing antibiotics, I'm not bashing the healthcare system. It is so good to save your child's life, but the overuse of these things have led to challenges, and the worst of these medications are really those neuro meds. They really, really, really beat up our ability to grow and to thrive. And so these kids are prescribed ADHD medication. I would argue, or I propose to you, that the only difference between your colicky baby and ADHD is time, right? In many cases, it's time. So the same stress response that caused that colicky, chronically sick kiddo is the same stress response that's still in your child's nervous system when they're being diagnosed with ADHD or SPD or emotionally behavioral stress disorders. They are still challenged, and it's been there the whole time. We're just labeling it something different so that we don't have to deal with it, or so that we can pass the buck onto somebody else. So if our nervous system controls the behavior and it controls and it perceives the environment, but that nervous system has accumulated trauma after trauma after trauma that it builds and builds and builds. No wonder we are starting to see neurological disorders skyrocket. No wonder we've been looking for answer after answer with no help or no hope. Your child has no shot at healing. You have no shot at healing if the system that controls every organ, cell, and tissue in your body, that nervous system, is struggling. So the way to think about your nervous system is a gas pedal and a brake pedal, right? So you have the gas and the brake. The gas pedal is sympathetic dominance. That is the sympathetic part of your nervous system. That is designed, you push that down when you need to run from a bear. You need to push that down when you're in a fight or need to run from a fight. That should be a very small part of our nervous system. The gas pedal, briefly we hit the gas pedal. Most of the time though, we need to be able to hit the brake pedal. What is the brake pedal? That's the parasympathetic. That's the rest and digest side of the nervous system. And you can see that here on this chart. We have a gas and a brake pedal. And under that gas pedal and brake pedal, you see that stress response. You see the vital functions of life. And under the brake pedal, you see things like going to the bathroom. You see things like sleeping. You see things like healing. That is the growth mode. You need to be able to have the brake pedal working very effectively to actually grow and heal and thrive. But here's the problem. This is a tachometer on this diagram. This tachometer starts with trauma, it moves into toxins, and then we add thoughts. So we have physical trauma at birth, or maybe in utero, toxic trauma at birth, or maybe in utero, and then we add more toxic trauma as our kid gets sick with drugs, shots, antibiotics, chemicals that they're exposed to, and then comes the emotional stress, right? So we call it trauma, toxins, and thoughts, the 3 T's. And when you compound these 3 T's, these 3 variables, you just rev up the gas pedal. Push gas pedal harder and harder and harder as you compound these 3 variables. So here's the challenge. We need to figure out how we can hit the brakes, because you can't ever expect to heal when you are 0 to 90 with the foot on the floor. You can't ever expect that your kiddo will heal if they feel like inside there's a lion following them around in life. If there's a lion in the bathroom, they're gonna have a hard time going to the bathroom. If there's a lion in the bedroom, they're not gonna sleep well. If there's a lion in the living room and they're trying to heal from an infection, it is not going to go well. We have to get rid of the lion. We have to learn to hit the brakes. And it starts by, yes, removing these 3 T's, but at the end of the day, we need to find where that first T started, how many T's, thoughts, traumas, or toxins have been in your child's nervous system, and for how long. Because at the end of the day, if we know that stress stuck on is really what is keeping our child's nervous system from thriving, and it's affecting the autonomic nervous system, we can't expect motor, we can't expect gut, we can't expect immune system to work appropriately if we're stuck in that fight or flight mode with the gas pedal all the way on. So the algorithm to unravel the perfect storm, this is the answers that you're waiting for. The algorithm, how we unwind this perfect storm in our offices around the country, is that we ask the question, is how much stress, how much of these 3 T's has your child experienced? When did the stress occur? And from those 2 questions, we can then determine how much care will they need and for how long will it take to help restore this neurological balance between the gas pedal and the brake pedal. It's very simple. How much stress, how many of those 3 T's, when did it occur? And that will help us determine how much care your child would need for how long to help restore that neurological balance. In times when there's trauma at the brainstem, right, in the area that the brain is first trying to develop, it impacts the vagus nerve, which lives right here. It impacts the sensory input to the brain. And when the brain is struggling to perceive the environment, it can't learn, it can't grow, and then it definitely can't put an appropriate output like speech or motor if the input is being scrambled. So that's called disafferentation. The next D, the 3rd D, is dysautonomia. So when you have abnormal alignment and movement, maybe due to physical trauma, and then you have abnormal sensory incoming data, the nervous system is struggling to bring that into the brain, then you start to get that gas or brake pedal imbalance. It's called dysautonomia, or an imbalance of the autonomic nervous system. And we start revving down that gas pedal, the child goes into fight or flight, and then we start to see the organs, the immune, the gut, the hormone systems, the endocrine systems start to shut down or basically drive away out of control. So that then leads to dysfunction dysfunction of those symptoms, right? And that's that fourth D is those organ systems start to be dysfunctional. And so we may see that in constipation. We may see that in recurrent allergies. We may see that in chronic sickness. We may see that in autoimmune conditions. We have abnormal movement or dyskinesia, abnormal sensory input, which is disafferentation, abnormal balance of the nervous system that has to work to control everything, and then dysfunction of the systems that we typically see as being most symptomatic, right? That you typically are in and out of the pediatrician for. And frankly, that's exhausting for our kiddos. And so when we see the depression, we see the anxiety, we see the fatigue, we see the shutdown, drive or wanting to learn or ability to learn, that's called dyskinesis, and that's an abnormal energy expenditure or output. So when we see dyskinesia, disafferentation, dysautonomia, dysfunction, and dyskinesis in one of those kiddos, we say, man, this kiddo has been experiencing these three T's. They are literally experiencing stress in their nervous system and it's stuck on. And what we know is that this dysfunction, it's called somatic dysfunction. In our office and among the pediatric chiropractic circle and clinically, the term that you commonly hear is subluxation. And at the end of the day, subluxation just means disconnection, right? They are disconnected from the outside in. Their input is disconnected from receiving, the brain is disconnected from receiving normal input. So as I showed you, there is literature after literature after literature. There's paper after paper. The science is catching up. We now know that somatic dysfunction or subluxation is happening in our kiddos in the birth process. We have Journal of Pediatrics, we have Journal of Psychiatry, we have meta-analysis Journal of Pediatrics, we have Journal of American Medical Association, we have British Medical Journal, Journal of American Medical Association Psychiatry, over and over and over again, showing that birth trauma is the moonwalking bear, that stress in early childhood development causes a challenge in our kiddos and really probably many of the adults that are sitting here, you relate to being struggling with this for 20 or 30 years. This has been in your nervous system and it's affected your brain for decades. There's really a key window. And what's the difference in maybe you who maybe struggled with mild ADHD or maybe struggled with stress or anxiety, maybe later in life and didn't really struggle with sensory processing disorder. Maybe you weren't diagnosed with emotional behavioral disorder. Maybe, what's the difference in the spectrum with autism? The difference is how much stress and how long. Remember the algorithm? And so what we know, you can see here in this chart, human brain development starts in utero. It starts before that child has even entered into this world, and it continues and peaks at 1 year of age. The peak of brain development happens at 1 year of age. We see sensory, we see vision, we see language. Higher cognitive development continues up until about 2 years of age, and then the body starts cutting synapses. It starts shutting things down that it doesn't need to function in this world. So you can see here, when you look at these neurons, they should be bright, beautiful, spread out like stars or branches in trees. And when you have trauma to the brainstem, when you have trauma to the brain in early childhood development, these neurons can't develop. This is what a toxic neuron looks like. And so we actually see that the brain architecture changes from early trauma. And what the research is calling this is another D, it's diaschisis or developmental diaschisis. And what it means is that if there's trauma to the brainstem or the cerebellum or the base of the head, and it happens in a key neurodevelopmental window, i.e. that 0 to 1 or 0 to 2 time period, then it causes shutting down or toxic shock into other parts of the brain, like the frontal cortex, that you want your child to use to sit still, to focus, and to learn. Or it causes a toxic shock throughout the brain into the amygdala, into the seat of emotions in your childhood's brain. And that's why they have no idea how to express their feelings, because it is a disconnected input, a disconnected traumatic stress response that is literally developing into their brain. So they have no shot at regulating. They have no shot at healing or thriving as long as that stress is there. So once that diaschisis happens, we start to see distortion, disruption, disconnection, and ultimately damage. And it's really, really, really hard to see this. On the extreme end of the spectrum, we have autism. In the 1970s, it was called locked-in syndrome. The reality is that these kids, if you flip that on their head, they're also locked out of experiencing life. They're locked out because they can't input and they can't perceive that it's a beautiful sunny day. They input that stimulus and it goes through this shocked, distorted neurocircuitry, and it comes out as maybe struggling to speak. It comes out as emotional reactions. It comes out in garbaged words. It comes out in screaming and yelling, or it gets trapped in and causes a stress response, and you see recurrent sickness. So subluxation equals disconnection. And so when a kiddo comes into our office, we can actually measure this disconnection. We measure it through the neurospinal system. We measure it from C1, or the atlas, the brainstem level, all the way down to the sacrum. And why we're measuring the spine is the information highway, or it is the fuse box for your child's brain. It's the fuse box that regulates the input and that sensory information into your child's body. The reality is that your body can handle a significant amount of stress. Your kiddo's body can handle a significant amount of stress, but the body is brilliant and it has a defensive mechanism. Because if it experiences trauma, if it experiences toxins, if it experiences emotional stress to the brain, it will try to adapt to that. And if that stress does not leave your child's body, it's very simple. It works just like the breaker box in your house. That stress will overload the body, and that neurospinal system along the spinal cord, a bone will shift out of place. Literally, the breaker will flip. It's just like the breaker flipping so that the box doesn't blow. And the reality is when that breaker flips in your house, it shuts down what? It shuts down the power from your brain to communicate to the rest of the body. It shuts down the power from that breaker box to the refrigerator or to the toaster oven, right? And so when that kid is living with those breakers flipped, that means that kiddo is living with sensory or input distorted, and it stresses the brain. And so we're able to evaluate this with SEMG scans, with heart rate variability, with thermography, and we're able to actually show it and see it, as you can see here. These are samples of scans of kiddos that have literally stress stuck on. On this far left, we see that the very top neck bone is bright red. Far on the left, that means that breaker is flipped over, right? That's that disafferentation, and what it's putting out is abnormal energy output, or dyskinesis, right? We measure this in microvolts, and this kiddo is exhausted. Their nervous system is having to work 3 to 4 times harder than normal just to function. And then on the far right of these scans, we see this colorful red, yellow, and green graph. This is our heart rate variability graphic that shows that this child is stuck with a gas pedal on, and if they're stuck, remember, there's a hierarchy of healing. Autonomic nervous system has got to be regulated first. Then we can start fixing the motor or the neuromotor system, and then we can start looking at things like the gut-brain connection. So I want you to take a second and check out this story. This is Phoenix. We call him P. Phoenix came into our office. This is straight from our Instagram channels. We have great stories popping up every day from our clinics around the country. And P's story happened in Austin, Texas. And P came into our office very shut down, very quiet, very clingy to his mom. He would cry and cry and cry, basically for the first 2 to 3 years of his life, nonstop, whenever his mom would set him down. And his mom knew this was not normal. His mom knew that something was off, but she really could get answers from nobody. And they were just saying that's just the way he is. That's just his personality. He'll grow out of it. And so check this out. This is P after P had his breakthrough. After P's nervous system, or Phoenix's nervous system, cleared, he goes to his mom one day after a couple months of care, and he wakes up in the morning and says, "Mom, I am brave now." And since that day, he runs around the office, he plays, he smiles, he high-fives, he loves to hug his mom, he loves to cuddle, but he doesn't need to. He's not shut down, he's not in fight or flight. This is what a child looks like when that gas pedal gets let off and the brake pedal gets to be hit. They start to regulate and they start to act like normal children. And his mom said, "Hey, I just thought this was his personality. I thought he would always have this. I had no idea why he was sick and clingy and struggling. And I've honestly prayed and I've been looking for answers, but there was no label, there was no diagnosis, there was no answer to what was going on with my kid. But I know for sure, now looking at those scans, now looking at P, that he was stuck. He was stuck with the stress response." This next video, man, this guy's name is Rolando. Rolando, what's cool about this video, this is the day after Rolando's first adjustment. Rolando was born into this world at 37 weeks. The cord was wrapped around his neck. He had to be resuscitated at birth. And when he came into our office after he's 2 years old, he's bright, flush, red skin, was screaming and clinging just like P, but to the point, to an extreme where the mom could not keep him from screaming without putting an iPad or stimulation in front of his face the entire appointment. Clinging to mom, iPad, massive stimulation, right? Which is basically artificial dopamine due to the lack of movement in that neuromotor system. And so what we did is we got Rolando scanned. We got him scanned and we saw the stress that was stuck on at his brainstem level due to that case history. You can see a sample of the scan here. We see the red here and here between the atlas, which controls the vagus nerve, and that brake pedal, and then the axis, which is responsible for motor and movement, right? We said motor matters most, which then led to stress being shut down in his gut. So this child, Rolando, gets one adjustment, and I'm gonna replay this video because this is Rolando the next day. No iPad, no mom. He's playing with these toy fruits, these baskets, he's sorting, he's organizing, he's coloring, he's regulating. His gas and brake pedal, his autonomic nervous system is regulating, and now he has the opportunity to thrive. Now we're gonna see language skyrocket. Now we're gonna see learning exponentially increase because the stress has been turned off and or the brake pedal has been hit. This is Luna. Luna, same story. This is in one of our Florida clinics. Luna was struggling with sleep. She was struggling with emotions, and her mom was really worried about her language, right? And the reality when we did the testing is that Luna's story was not a language problem. It was not an output problem. She was able to form sentences, but the input, the sensory system, we measured it with those insight scans, was disrupted. And she was basically disconnected from intaking data and being able to articulate it out. Within a few weeks of getting her first adjustment, she starts forming full sentences and her vocabulary skyrocketed like it was there the entire time. Because the reality it was, she had learned, she had the ability to speak and she had the knowledge to speak, but the disconnect, the stress had shut her down. One of my favorite stories is from several years ago. This is Pax. Fun story, Pax's father also shares my name, and he actually opened for Justin Bieber back before Justin Bieber really made it big. And he is just joyful. The dad is super joyful, and he's actually a comedian. And it was really devastating and heartbreaking when he brought his son Pax in because all that comedy, all that joy, all that laughter in his life was gone. Why? Because he was scared, he was searching, he was frankly probably a little depressed and struggling, looking for answers for his son. Because at 19 months, Pax wasn't walking, which is, as you guys know, way late. He was not pooping, he was constipated. He was under 5% in growth, and language had not turned on, he was not communicating well. And so what Pax comes into this office, within a few days, 3 days or so of getting his first adjustment, he starts pooping. Right? Why does he start pooping? Because all of a sudden the brake pedal gets hit. Because we basically opened up the input communication of the vagus nerve, which is your gut-brain connection, and it starts stimulating and communicating between the brain and the gut. He starts pooping. Within about 3 weeks of pooping, this kiddo starts walking. He starts walking, he starts engaging his core, he starts thriving, and he starts growing, he starts eating, and now he's kindergarten. He's in kindergarten, about five or 6 years old now, and he has caught up in all his milestones. He's caught up in growth. He is caught up. There's no kind of cognitive delay or cognitive challenges for him. He's a thriving kiddo because we were able to bring and reconnect that sensory input. We were able to hit the brake pedal for him, and thank God that Peter found our office because the reality is there are many dads like Peter. There are many moms like you looking for answers. They have a stuck kiddo. They've said, hey, your child's just gonna fail to thrive. That's what Pax was labeled with, failure to thrive. We don't know why. We don't know why. We can pray he goes out of it. So some of you guys are sitting here and you're actually the parent of a grade school kid. You're like, my kid's not a toddler anymore. I don't have an infant. Please do not feel that mom or dad guilt. if you are saying this story matches with mine, but my kid is really, they're 6 years old, they're 10 years old, they're in grade school. And we were struggling for that with years, and somehow we made it, but we just cannot break out of the emotional dysregulation. It is not too late, right? Here's a story of a kiddo who had emotional outbursts, sensory processing challenges, was struggling getting out of class, was constantly suspended from school. This is an elementary school kid. And then after, you can see his scans here, we start to see better emotional regulation. He starts actually learning from these classes and coming home excited to tell his parents what was going on. He starts rocking it in school and really loving to go to school every single day. And so that dysregulation that he experienced was really the same dysregulation that he experienced as a colicky kid, a constipated kid, dysregulated and chronically sick kiddo. It just looked differently and was called something different as that stress matured and developed in his body. Then you might be a parent and say, well, I don't have a toddler and my kids are actually teenagers now, but honestly, what you've said resonates with me. My kid was like this all growing up and now they're a teenager. And honestly, I've been talking to the doctor about getting a medication for depression. I've been talking to the doctor about getting medication for chronic migraines. This is Joel. He came into our office as a 14-year-old basketball player with literally 5 years of chronic migraines, right? So that means that before he was even a teenager, as a 9-year-old, this child was struggling with migraines. Of course, what went along with that? Yes, you guessed it, constipation, anxiety, lack of sleep, all the signs of stress and the gas pedal being revved all the way down with no brake pedal possible. Within one adjustment, and it does not always work this way, but those migraines stopped immediately. And within several months of care, this kid started to get life back. He started to get zeal back. He started to get joy back. Now he is thriving. He's playing varsity basketball. He is thriving in school. He's driving now, which is crazy. But he's a different kiddo. No depression, no anxiety, no migraine headaches, no digestive issues. Not because we treat any of those things individually, but because his nervous system, for the first time in 14 years, had the opportunity to regulate and to thrive the way it was designed. So a lot of moms, just wrapping up here, saying, okay, how do you get a sensory kiddo? How do you get a child with autism? How do you get a child with ADHD to sit still to do this testing, to do this neurological testing? It is super simple. It is fun. It is loving. Our team is incredible at this. You can see Rachel here walking through our scans with one of our toddlers. A lot of times the moms will hold them and cuddle them while we scan them. A lot of times we will read one of our favorite books to these kiddos and just love on them and nurture them as they get scanned. We are prepared and we are well equipped. This is also a sample of how gentle a chiropractic adjustment can be. There is no cracking or popping in pediatric chiropractic care. We are gently stimulating and gently putting sustained pressure in these kiddos' nervous systems so that their body can begin to regulate again. This is a newborn baby. This baby, if you look at this little dude, he is just a few weeks old and he did not even wake up until the very end of this adjustment. And what we saw as a result of adjustment to a child like this is that he did not become the anxious, depressed teenager. He did not become the chronically sick toddler. In fact, he's never had a medication in his life. He is now 2 years old. Yes, he's got more work to go, but no ear infections, no antibiotics. And he lashed incredibly after this adjustment. He pooped incredibly and he slept incredibly. What mom or dad does not want a kiddo that will thrive like that really through infancy? So keep seeking answers, keep anchoring to hope, schedule a consult and a time to dive into a case history with one of our providers to get these neuro scans, and at the end of the day, get you back onto a path of your family experiencing optimal health, optimal wellness, doing what you love, and ultimately what you and your family are called to do.